Hey guys, welcome to my channel. Uh, if you haven't been here before, welcome back. If you have, for those that haven't been here, my name is Keitha, and I did graduate college in animal care, which is vet assistant, where I'm located, which is in Canada. Um, so today's video is going to be a vet video on first aid tips and what you should have in your kit. I'm not sure if I'm going to continue doing animal content or switch to something else. It just depends on my job. I've interviewed for a place. They just have had delays with getting the store ready to open. So they had to pause hiring. So I will know maybe in a couple weeks about that. So let's just jump into the video on first aid and kit, what you should have in your kit, and what tips and tricks might help you with first aid. Okay. Sorry, I just have some notes from my school about from my college. I just want to make sure I give you all the information. Okay, so I'm not going to be able to explain this one very well. I'll have to come back to that or put it in the pinned comment. But the special pads are called Tefla pads, TELFA pads, that you can use. This is a list of stuff to have in. Just normal square 4x4 gauze, that you can use, to help put pressure. There's elastic wrap, such as vet wrap or tensure bandages, that you can put on as well, that can help keep things like to keep pressure. There's special bandage tape, bandage scissors, lubricant such as KY jelly is an option. Antibiotic ointment, such as polysporin, and there's triangle bandages that would be good to have as well. You should also have in your first aid kit is tweezers, or in the medical field they're called hemostats, or actually they're two separate. They look fairly similar, kind of. Clippers or sharp scissors for removing hair, so you can get access to the cut of the pet, so you can help clean it out and get the bandage more secure around it. Antibacterial soap, so you can clean out the site. And antiseptic wound flush or saline, so that would help clean out any bacteria, dirt, rocks, whatever that could have, wherever the accident happened. You could use the saline or flush to clean it out as well. Syringes for giving any oral meds or flushing the wound that was sustained. First aid, you should have eye flush as well in case there's some sort of accident with the eye. Polysporin, you can use 3% hydrogen peroxide that will help clean up any blood, or you can use it for different things. Activated charcoal, that will help if they ingested something that they were not supposed to ingest. Actually, I don't even know if I should have shared that. Um, I don't know if it has other uses. At my vet clinic, we used activated charcoal after a pet has ingested something and the vet determined that it was safe to induce vomiting. And then we gave charcoal to help absorb any leftover toxins from whatever they ingest. Benadryl, which is safe for at least most dogs to have Benadryl. Just make sure you contact your vet, but because it could depend dog to dog. Quick stop or cornstarch. Quick is spelled Kwik. And this is if there was a nail injury, you can use it to stop if there was a nail injury and it's bleeding, you can use that to stop the blood. You should also have hot and cold packs, depending on the situation. One might be warranted, or you can alternate depending on the injury. A thermometer would be good to check temperature in case you start getting a fever. What else? Make a list of important phone numbers. It should include your veterinarian clinic, veterinary after-hour merge, poison control. Safe over-the-counter drugs. A&D ointment, Benadryl, which is antihistamine. So 2 to 4 milligrams per kilo up to 3 times a day for dogs. Cortate cream, 0.5% hydrocortisone. I think these tear gel, polysporin and polysporin eye drops. Batrobane diaper rash cream, Epsom salts. Okay. Keep in mind topical meds that are okay to apply may not be okay to ingest. Certain medications we can't even ingest. It's only topical, so make sure that the pet can't get any of that. How do you stop a dog licking its eyeballs? There's trying to get it in view of the camera. There's goggles that you can put on the dog over the dog's eyes. Okay, I don't even know. There was only certain Benadryl. I'll go back to that. Benadryl allergy. Diphenhydramine is the one. Unsafe is allergy plus sinus headache is not safe to give to dogs. Tylenol, do not give to dogs. Ibuprofen, do not give to dogs. Aleve, do not give. Tea tree oil, do not give. Strong steroid creams over 1% hydrocortisone or other steroids, do not. Pseudohydrogen, other decongestants, hypertension, arrhythmias, tremors, and seizures, do not give. At-home dog cities. Just because something is natural does not mean it is safe. Cats are not small dogs. 3% hydrogen peroxide. Inducing vomiting at home, not recommended for cats. This is if the doctor gives you approval. If you know exactly the amount of what the pet ingested, call your vet. Make sure it's okay with them. If they say you can induce vomiting, then you can do this and ask them first. To induce vomiting for dog, it's 1 to 2 ml per kg to a maximum of 45 ml, 3 tablespoons. This dose can be repeated once, no more. Can cause oral GI irritation and ulceration. But only do this if your vet says that you can do it. Poison control for ASPCA is 1-800-88-426-4435. And this is, I believe, for the American. And there's a $65 consultation fee. Absorbing toxins, that's the activated charcoal, absorbs and binds toxins in the GI tract. Doses 0.5 to 1 gram per kg may be repeated. Some dogs will eat it mixed with a small amount of food. When not to induce vomiting. When your dog ingested an acid-based chemical, an alkali-based chemical, a caustic like bleach or drain cleaner, a household cleaning solution, a household chemical. When not to induce vomiting. Part 2. A product whose bottle clearly states, do not induce vomiting. There are toxins that potentially may burn the esophagus on the way up, or there are objects that may injure tissues severely when brought up. A petroleum product such as gasoline, turpentine, kerosene. Sorry about that. And finally, when not to induce vomiting. Do not if your dog has vomited already, if your dog is unconscious, if your dog has labored breathing, if your dog is exhibiting nervous system disorders or a seizure. Some tips for wound care. Place pressure with gauze or clean cloth to stop bleeding. If there is debris, flush the wound with saline or clean water. For deep wounds or severe bleeding, keep pressure until you can get your pet to a veterinarian. For seizures, the most important thing is to protect your pet from self-injury. Do not place your fingers or any object near your pet's mouth. Clear the area around your pet to help prevent injury during the seizure. Do not attempt to restrain your pet, but you can place a hand on their body. When the seizure has stopped, contact your veterinarian for further instructions. If the seizure does not stop within 3 to 5 minutes, or if your pet comes out of the seizure and goes into another one within an hour, transport the dog immediately to a veterinarian. Choking. If choking, hold the upper jaw open with one hand and look for a foreign object. Unless you can clearly see and grasp the object, do not put your fingers into your dog's mouth or throat. Lift smaller dog's legs into the air so gravity can help dislodge the obstruction. If you can't remove the foreign object, use the heel of your hand. Deliver 4 to 5 sharp blows on the dog between the shoulder blade. Let's just see what that looks like. If you suspect poison, seek care immediately. If you cannot get to the vet immediately or waiting for a ride or are stranded, you can call either of these 24-hour emergency lines. ASPCA, Animal Poison Control Center, 1-800-88-4-ANA-HELP, or 1-800-88-426-4435. Or there's the National Animal Poison Control Center, 1-800-548-4646. 2423, and I will put those in the description. Okay, there is some treatment for wound I have here. First thing you're going to want to do is to stop the bleeding. You will use hand to apply pressure. Apply gauze, vet wrap, leave for 5 minutes. Check and keep an eye around the bandage to make sure there is no swelling, and to see if it stopped bleeding. If not, then keep it a little bit longer upon recommendation from your veterinarian. Cover the wound until arrival to the vet. May need to apply water-based ointment. Lightly bandage until vet can take care of it. Clean. Fill wound with KY jelly. Shave, trim hair. Flush lube out with sterile saline. Lavage wound with sterile saline. Sorry, some of this is kind of hard to read because there's a lot written. Debridement iodine chlorhexidine. Rinse dry. Those are certain things that you can use to help. But I forget exactly the steps for that. Apply ointment. If no sutures are required, antibiotic ointment, polysporin, Hiputane, etc. No ointment for suture. No ointment. Local anesthetic or general anesthetic. Absorbable, non-absorbable sutures. First intention healing. Suture soon after injury. Clean wound edges and healing will go well. So some of this is more for vet practice. Second intention healing. Suturing an old wound because it is not going to close on its own. Skin will not heal smooth. Granulation. Tissue. Bandage, apply if necessary, wet or dry, sterile gauze, cotton, cling, vet wrap, tape. That's what is needed for that. Bruise, heat, pain, swelling, cold therapy, cold compresses, and NSAIDs, which stands for non-steroid anti-inflammatory drugs. Puncture wound. Want to keep open so will heal inside out. Use syringe with hydrogen peroxide to flush daily until the healing reaches the skin surface. Okay, so that is it for this. I will leave the poison control number in the description down below in case it's ever needed. This is for America. I don't have the Canadian one, at least written. I can look it up before I post the video. I hope this helps you guys if you do ever need it. Hopefully it's not needed. And I will see you in the next phone. Let me know what you guys want to see, as I might not be able, I might choose to not do any more vet content, as I don't know if I'm going to be in the vet field any longer. Okay, so see you in the next one.